from the station that's on your side. This is Channel 7 News at 6.
Back pain is one of the most common reasons people go to the doctor or miss work, and a leading cause of disability. In tonight's Health Check report, we share the story of one man who tried everything to relieve the pain in his back and finally decided to have surgery to fix the problem.
Phillip Wallace is active and full of life, a runner who does his best to stay fit, but one small movement last year stopped him in his tracks.
And I leaned over to open a cabinet in my bathroom, and in the next few seconds I was flat out on the floor in writhing, agonizing pain, spasming in the back.
His primary care doctor told him a disc had shifted out of place. He tried physical therapy and spinal injections, but there was no difference in the pain.
They would always ask you how on a scale of 0 to 10, how are you hurting each day? Most days it was 9 or 10 without even getting out of the chute.
After living with this excruciating pain for 10 months, he sought help from neurosurgeon Dr. Phillips at Baptist Health. X-rays showed that Wallace had not one but 2 fractures in his back that had likely been there for years. Dr. Phillips gave him the option of spinal fusion surgery.
He required an operation at 2 levels because of the degree of severity of those fractures. We basically removed or drilled away those fracture sites in his low back, but that created even more instability, and so he required screws to help stabilize the spine.
They fused 3 discs, L2, 3, and 4. I have 6 titanium screws in this spine.
Wallace knew the risks that come with back surgery, but he's glad he made the choice to go through with it. He says he instantly felt better, and within a few weeks, he felt great. Within 4 months of his operation, he was running again.
You have to make decisions that are not going to be easy when you do this. But again, when you think of the alternative of extreme pain versus the chance or proof that it's going to get better, that's an easy choice.
Now, there are obvious risks associated with this type of procedure, so doctors say you should only rely on back surgery as a last resort. But for him, so far, so good.
Absolutely. That's a tough problem to deal with.